A healthy male, laughing one moment, gasping for the other next. This is anaphylactic shock, a medical emergency that can kill in minutes. What exactly is happening inside the body? How do you recognize it? And what's the only drug that can save a life? Let's break it down ICU style. Hello, this is me, Mass Medico, and welcome back to my channel ICU Simplified, where we try to break down the complex concepts into simple ones. Anaphylactic shock is a more severe form of allergic reaction. The immune system, instead of protecting you, overreacts to a harmless trigger, releasing a flood of chemicals like histamine that cause widespread inflammation, airway narrowing, and a sudden drop in blood pressure. The most common culprits: insect stings like bees or wasps, foods, peanuts, shellfish, eggs, medications like penicillin or NSAIDs, even latex. But in the ICU, we have seen anything trigger anaphylaxis, from contrast ties to exotic foods. This is the moment the allergic reaction begins. When your body encounters an allergen, like a bee sting, immune cells called mast cells spring into action. They burst open, releasing powerful chemicals, the most important being histamine. Histamine makes blood vessels widen and leak, causing redness, swelling, and the classical hives on the skin. Inside, it also narrows the airways, making breathing difficult. This chemical storm is what drives the dangerous drop in blood pressure and oxygen delivery, the hallmarks of anaphylactic shock. Anaphylactic shock is a more severe form of allergic reaction. The immune system, instead of protecting you, overreacts to a harmless trigger. Anaphylaxis does not hide, it shouts. Watch for the swelling of lips, tongue, or throat, raised itchy skin, rashes called hives, wheezing or difficulty breathing, nausea, vomiting, or sudden collapse. Most dangerously, a rapid drop in blood pressure that can lead to shock. Pathophysiology. What happens inside the body? Here's the science. The allergen binds to immunoglobulin E antibodies on mast cells. This triggers massive degranulation, releasing histamine and other mediators. As I told before, this leads to dilatation of the blood vessels, and which lead to BP drop. Capillaries leak fluid, which leads to swelling and airway obstruction. Bronchi constrict, resulting in decreased oxygen delivery. Without intervention, multiple organ failure can occur within minutes. Emergency response. In anaphylaxis, seconds matter. The only life-saving drug is epinephrine, which is given as 0.3 to 0.5 milligrams for adults intramuscularly in the mid-thigh. Why IM? It's fast, reliable, and safer than IV in emergencies. Call for help, lay the patient flat with legs raised. Unless breathing is difficult, do not wait to see if symptoms improve. So, what about hospital care? In the ER or ICU, treatment includes repeat epinephrine if symptoms persist, high flow oxygen, rapid IV flows to restore blood pressure, antihistamines for skin symptoms, corticosteroids to prevent late phase reactions, nebulized bronchodilators for persistent bronchospasm. Prevention and preparedness. Once somebody has had an anaphylaxis, they are at increased risk again. They should always carry an EpiPen, wear a medical alert bracelet, and have an allergy action plan. Educate friends, family, and colleagues. Awareness saves lives. Anaphylactic shock can be terrifying, but with knowledge, preparation, and rapid action, lives can be saved. Thanks for watching. Like, share, and subscribe for more ICU Simplified content. This is me, Mass Medico, signing off right now. Take care, bye-bye, stay safe, stay blessed.